Good morning, students. Today's class is on anatomy of peritoneum, part first. Learning objectives for my today's class are: at the end of this session, students should be able to define peritoneum and peritoneal cavity. They should be able to describe layers and functions of peritoneum. They should also know arrangement of viscera within peritoneal cavity. Blood supply, lymphatic drainage, and innervation of peritoneum will also be discussed in this session. They should be able to describe ligaments, mesentery, and omentum. MCQ type questions at the end of this session of revision and assessment. The word peritoneum is derived from the Greek word peritonion, which means stretch around. Peritoneum is a continuous serous membrane which lines the abdominal cavity and covers the abdominal organs. It supports the viscera and provides a pathway for blood vessels and lymph. Histologically, it is composed of single layer of flattened cells called mesothelial cells. These cells rest on underlying areolar tissue. It varies in thickness and density in different places. Submesothelial connective tissue contains macrophages, lymphocytes, and adipocytes. Mesothelium is freely mobile over underlying structures. Total surface area of peritoneum is equivalent to surface area of the skin. The visceral peritoneum accounts for 60% of total surface area. Peritoneal covering the mesentery and omental surface accounts for 30% of peritoneal surface area. The parietal peritoneum accounts for only 10% of its surface area. In surgery, it is said that generalized peritonitis is equivalent to 100% burns. A patient with generalized peritonitis, like 100% burns, rarely survives if left untreated. A peritoneum line is abdominal cavity. Peritoneum being the largest serous membrane that lines abdominal cavity. It covers anterior and posterior walls, undersurface of diaphragm and pelvic cavity. As shown in this slide, this red dotted area represents the peritoneum covering the undersurface of diaphragm, floor of pelvic cavity, anterior and posterior abdominal walls. Thus, peritoneal cavity is a cavity within abdominal cavity. If we take a horizontal section of the abdomen and trace peritoneum from midline, parietal peritoneum lines the anterolateral abdominal wall. It also lines posterior abdominal wall, then gets reflected as a double-layered fold, then invests gut tube, where we call it as visceral peritoneum. If we go to the layers of the gut tube, it is composed of 4 layers: mucosa, submucosa, muscular layer, and serosa. Serosa, in fact, represents visceral peritoneum. So it receives its blood supply, nerve supply from the vessels and nerves. We supply the gut tube. So peritoneum is a serous membrane that lines abdominal cavity. Parietal peritoneum lines abdominal wall. Visceral peritoneum lines external surface of most of the viscera. Between the two layers is peritoneal cavity. Contains peritoneal fluid which lubricates mobile organs. As shown in this diagram, parietal peritoneum lines the body wall as shown by this arrow. Visceral peritoneum surrounds the loop of gut. Between parietal and visceral layers lies peritoneal cavity, which is a potential space. Peritoneal cavity is open in females. This is because of the fact peritoneum communicates with exterior through genital system of females. Ascending infections can go from external genitalia to uterus. From there, they can spread through uterine tube into peritoneal cavity. What are functions of peritoneum? Peritoneum forms lining of abdominal cavity. It supports many of the abdominal organs mechanically as well as serves as a conduit for their blood vessels, lymphatics, and nerves. It protects viscera against infection by its phagocytic action. It provides cellular and humoral immunological defense. Peritoneum acts as a reservoir of fat and energy. In this slide, you can see the section of ileum enclosed in double-layered mesentery. If we give an incision in the mesentery, what do we see inside? Blood vessels supplying the gut tube, veins draining the gut tube, lymphatics which cannot be seen with naked eye, and fat which serves as reservoir of energy. What is the difference between parietal and visceral peritoneum? Parietal peritoneum is derived from somatic mesoderm in embryo, so it receives the same nerve supply as the region of the abdominal wall it lines, and it is pain sensitive. It is sensitive to pressure, pain, laceration, and temperature. Blood supply from the abdominal wall. Blood vessels of the abdominal wall also supply parietal peritoneum. So parietal peritoneum receives its blood supply from lumbar, intercostal and epigastric regions. Peritoneum drains into inferior vena cava. Visceral peritoneum. Visceral peritoneum is derived from flank neck mesoderm. So it receives its blood supply from vessels of the gut tube and drains into portal vein. The total peritoneal blood flow ranges from 50 to 150 ml per minute. The visceral peritoneum is supplied by the autonomic nerves, so is pain insensitive. Unlike parietal peritoneum, pain from visceral peritoneum is poorly localized. It is only sensitive to stretch and chemical irritation. What is the difference between abdominal and peritoneal cavity? Are they same or are they different? The abdominal cavity is the space bounded by the vertebra, abdominal muscles, diaphragm and pelvic floor. It is different from peritoneal cavity which lines it. Peritoneal cavity is in fact a cavity within abdominal cavity. It does not include extraperitoneal or retroperitoneal structure. For example, kidney, suprarenal gland, abdominal aorta, and inferior vena cava. They are contents of abdominal cavity but not of peritoneal cavity because they are retroperitoneal structures. As shown in this diagram, peritoneal cavity lines the abdominal cavity. So it is a cavity within abdominal cavity and is smaller than the abdominal cavity. Peritoneal cavity is divided into two sacs. The greater sac, which is demarcated by a red dotted line, it represents the dialysate compartment in peritoneal dialysis. The lesser sac is smaller in size. It lies posterior to the stomach. It is also called omental bursa. It is formed as a result of rotation of the gut tube. It communicates with greater sac through epiploic foramen. Epiploic foramen is also called foramen of Winslow or additus to lesser sac. So what are the supports of the gut tube? To understand the anatomy of the mesentery, let us go to the supports of the gut tube in fetal life. Gut tube is supported by dorsal and ventral mesentery. Mesentery being a double-layered fold of peritoneum. Dorsal mesentery attaches gut tube with the posterior abdominal wall. Ventral mesentery attaches gut tube with anterior abdominal wall. Ventral mesentery disappears throughout except in the region of foregut. As a result of development of liver, ventral mesentery is divided into falciparum ligament which lies between the liver and anterior abdominal wall and lesser omentum which lies between greater curvature of stomach and proximal duodenum and liver. Arrangement of structures within peritoneal cavity. As already said, gut tube is supported by mesentery with posterior and anterior abdominal wall. Mesentery is basically double-layered fold of the peritoneum. It is divided into dorsal and ventral mesentery. Dorsal mesentery supports gut tube and connects it with the posterior abdominal wall, whereas the ventral mesentery connects gut tube with anterior abdominal wall. What are functions of mesentery? Mesentery acts as a route for blood vessels, lymphaticus and nerves. It holds organs in place and supports them. It stores fat. So mesentery is a double-layer fold of peritoneum. Portions of the gut tube are suspended from dorsal and ventral abdominal wall by mesentery. It encloses an organ and connects it to the abdominal wall. Divisions of mesentery. It is divided into dorsal and ventral mesentery. Dorsal mesentery is present throughout gut tube. It extends from lower end of esophagus to cloacal region. Caudal part of foregut, midgut and major part of hindgut are suspended from abdominal wall by dorsal mesentery. Ventral mesentery remains only in the region of foregut. Arrangement of structures within abdominal cavity. The structures in the abdomen are classified as intraperitoneal or retroperitoneal, depending on whether they are covered with visceral peritoneum and whether they are attached to mesentery. Clinical importance of dividing structures into retro and intraperitoneal is that structures that are intraperitoneal are generally mobile. They move with respiration during clinical examination, while as those that are retroperitoneal are relatively fixed in their location and are less mobile. What are secondarily retroperitoneal structures? Some structures, such as kidneys, are primarily retroperitoneal, while others, such as the majority of the duodenum, are secondarily retroperitoneal, meaning that structure is developed intraperitoneally but lost its mesentery and thus became retroperitoneal. Let us go to this slide to understand these terms. In this section, you can see abdominal wall is lined by parietal peritoneum. After being reflected from posterior abdominal wall, it becomes mesentery. Then it encloses a loop of gut which is intraperitoneal. In the second slide, ventral mesentery is there. Liver develops in ventral mesentery, dividing it into falciparum ligament which lies between the anterior abdominal wall and liver and under surface of diaphragm, and lesser omentum which lies between the lesser curvature of stomach, proximal part of duodenum and liver. Now in this slide you can see this on the right side, this loop of gut is intraperitoneal. During development, this loop of gut loses its mesentery and becomes retroperitoneal. Since initially it was intraperitoneal and during development it lost its mesentery. Such organs which lose their mesentery and become retroperitoneal during development are called secondarily retroperitoneal organs. What are retroperitoneal structures? So structures lying posterior to the peritoneum or behind the peritoneum are called retroperitoneal structures. Examples are kidneys, which are primarily retroperitoneal, suprarenal glands, aorta, inferior vena cava. Thus, the abdominal cavity includes both intraperitoneal and retroperitoneal structures, while as the peritoneal cavity includes only those structures which are intraperitoneal. To make understanding easy, let us go to this slide. This slide represents the abdominal cavity. Superiorly, there is diaphragm, then there is anterolateral abdominal wall and posterior abdominal wall. Attached with the posterior abdominal wall are kidneys, suprarenal glands, abdominal aorta and its major branches, and inferior vena cava. Ureter leaving the hilum of kidney can also be seen. Now these structures lie posterior to peritoneum and are called retroperitoneal. Now the same abdominal cavity is lined by peritoneum. We cannot see the above listed structures so because they are retroperitoneal. After opening the peritoneal cavity, we can see intraperitoneal structure which includes the derivatives of gut tube except the pancreas. Thus abdominal cavity is lined by peritoneal cavity. Certain structures lie posterior to peritoneum, they are called retroperitoneal. Those structures which lie within the peritoneal cavity are called intraperitoneal. So within abdominal cavity is a serous membrane lined cavity called peritoneal cavity. It is smaller than the abdominal cavity. Abdominopelvic cavity minus peritoneal cavity is equivalent to retroperitoneal space. What are various peritoneal folds? Peritoneal folds connect organs to each other or to abdominal wall. They are called as ligaments, mesentery or omentum. Omentum is a double-layered fold of peritoneum between stomach and other abdominal viscera. Lesser omentum, also called gastroduodenohepatic ligament. The span is between liver, lesser curvature of stomach and proximal duodenum. It is smaller than the greater omentum. It attaches lesser curvature of stomach and proximal part of the duodenum to liver. It is also called hepatogastric and hepatoduodenal ligament. Structures in the free margin of the lesser omentum are very important. So lesser omentum has a fixed margin and a free margin. In the free margin, there is hepatic artery, bile duct and portal vein. Free margin of the lesser omentum also forms boundary of epiploic foramen, which is bounded anteriorly by the free margin of the lesser omentum, inferiorly by first part of the duodenum, and superiorly by caudate lobe of liver. Posteriorly lies portal vein. It is said that epiploic foramen lies between two great veins. Anteriorly is portal vein in the free margin of the lesser omentum, and posteriorly there is portal vein. It is a slit-like opening through which greater and lesser sacs communicate with each other. Now, what is the arrangement of structures in the free margin of the lesser omentum? You can remember the arrangement of the structures. D stands for dextro, which lies on the right side and anteriorly. A stands for artery, which lies anteriorly. And P stands for portal vein, which lies posteriorly. Now, what is greater omentum? Greater omentum is again double-layered fold of peritoneum. It descends from greater curvature of stomach and proximal part of the duodenum, then folds back up and attaches to the anterior surface of the transverse colon. It has some role in immunity and is sometimes referred to as policeman of abdomen. However, recent studies have shown that it moves to the site of infection by chance and not by choice. So it is no longer regarded as policeman of abdomen. Peritoneal ligament is defined as double-layered fold of peritoneum. We may classify them based upon their shape. For example, falciparum sickle-shaped fold of the peritoneum between the anterior abdominal wall and undersurface of the diaphragm and liver. Triangular ligament has two layers. The two layers join together to form an angle, so it is named as triangular ligament. Coronary ligament. Corona means crown. In liver, there are two coronary ligaments, anterior and posterior. Anterior is also called the superior, and posterior is also called the inferior. They invest liver like a crown. Teres means rounded. Ligamentum teres hepatica is the round ligament of the liver. Ligamentum teres uteri is the round ligament of the uterus. And ligamentum teres of head of femur is the round ligament of head of femur. In this diagram, you can see that ligamentum teres hepatica, which lies in the free margin of falciparum ligament, as shown in this diagram. Round ligament of liver lies in the free margin of the falciparum ligament. So ligaments of the liver are falciparum ligament, coronary ligament, left and right triangular ligament, hepatogastric ligament, hepatoduodenal ligament, ligamentum teres hepatis. Ligament is associated with spleen or gastrosplenic ligament, which connects it with the fundus of the stomach. It contains short gastric vessels, lymphaticus, and neuroplexus. Splenorenal ligament between the kidney and spleen, splenocholic ligament between spleen and colon. Ligaments of the stomach are named as hepatogastric ligament, gastrosplenic ligament, gastrophrenic ligament, gastrocholic ligament, gastropancreatic ligament. What are pelvic peritoneal pouches? In male, there is retrovesical pouch between the rectum and urinary bladder. In females, uterus intervenes between the rectum and urinary bladder. So there is rectouterine pouch between the posterior superior surface of the uterus and the anterior surface of the rectum, and vesicouterine pouch between the superior surface of the bladder and anterior inferior surface of the uterus. What is vascular supply of peritoneum? Vessels of the body wall, which include lower intercostal arteries, lumbar arteries, superior and inferior epigastric arteries, supply the body wall. They also supply the underlying parietal peritoneum. Veins from parietal peritoneum drain into systemic veins, that is into inferior vena cava. Vascular supply of the visceral peritoneum. It is supplied by the vessels which supply gut tube and its derivatives. These vessels lie within the mesentery. For the foregut, it is supplied by the celiac trunk, superior mesenteric artery, and inferior mesenteric artery. Celiac trunk is the artery of foregut, superior mesenteric artery is the artery of midgut, and inferior mesenteric artery is artery of the hindgut. Veins of the visceral peritoneum. As already explained, if we take section of the gut, it is composed of four layers: mucosa, submucosa, muscular layer, and serosa. Serosa represents the visceral peritoneum. It receives its blood supply from the vessels which supply the gut tube, and its veins drain into portal vein. Drainage of peritoneal cavity. Drainage of peritoneal cavity is mainly accomplished by the lymphatic system. Importantly, the subdiaphragmatic lymphatic system is responsible for 70-80% of the lymphatic flow from the peritoneal cavity. The lymphatic system also serves as a pathway for the removal of foreign substances and macromolecules from peritoneal cavity. Now let us go to the applied anatomy. What is peritonitis? Peritonitis is inflammation of the peritoneum. So where from the infection comes? What are the causes of peritonitis? The cause can be rupture of a viscus leading to fecal peritonitis, rupture of gallbladder leading to biliary peritonitis, ascending infection, gonococcal peritonitis in females from ascending infections of genital tract. Blood-borne infections can also cause peritonitis. Peritonitis causes fever, tenderness, and pain in the abdominal area, which can be localized or diffuse. As already said, generalized peritonitis is equivalent to 100% burns. So, if left untreated, a patient with generalized peritonitis may die. Mortality is higher in elderly and if present for a prolonged time. What is peritoneal dialysis? Indication for peritoneal dialysis is acute renal failure. Procedure is less effective than the hemodialysis, but it is simple and can be done even at home. It is just like peritoneal lavage. Fluid called dialysate is introduced into peritoneal cavity through a tube. The fluid is then left there for a prescribed amount of time to absorb nitrogenous waste products by diffusion from blood, which are then removed through another tube. The reason for this effect is the high number of arteries and veins in the peritoneal cavity. So in peritoneal dialysis, nitrogenous waste products are removed with the dialysate. I want to summarize my lecture as under. Peritoneum is largest serous membrane which lines abdominal cavity. A potential space between its two layers is peritoneal cavity which contains a small amount of fluid for lubrication. Surface area of peritoneum is equivalent to surface area of cecum. That is why generalized peritonitis is equal to 100% burns. Double-layered folds of the peritoneum are mesentery, omentum, or ligamentous. These folds function to support viscera mechanically and also transmit nerves, vessels, and lymphaticus of the viscera. Parietal peritoneum receives blood supply and innervation from body wall, so is pain sensitive. Visceral peritoneum derives its blood supply and innervation from gut, so is pain insensitive. Peritoneal cavity is used for peritoneal dialysis. Now let us go for a quiz based on this lecture. You will be provided an MCQ with 4 options. You have to choose the most accurate one. False statement about peritoneum is: A. It is the largest serous membrane of body. B. It is lined by mesothelium. C. It is lined by flattened epithelial cells. D. Its parietal layer is derived from suplachnopleural layer of intraembryonic mesoderm. D is the wrong option. The largest cavity of the body is abdominal, peritoneal, abdominopelvic, pleural. C is the correct option. Which of the following statements is incorrect? Abdominal cavity is the largest cavity of the body. Surface area of skin and peritoneal cavity is equal. C. Peritoneal cavity is open in females. D. Peritonitis has worse prognosis in elderly. A is incorrect statement. It is abdominopelvic cavity which is the largest cavity of our body. Which of the following statements is incorrect? Abdominal cavity is the largest cavity of body. Peritoneal cavity is used for dialysis. Peritoneal cavity is open in males. Peritonitis has worse prognosis in young. C is the wrong option. Which of the following structures is not present in the free margin of lesser omentum? Hepatic artery, common bile duct, common hepatic duct, portal vein. C. Common hepatic duct is not content of free margin of lesser omentum. Which of the following statements is false? Peritoneal cavity is divided into greater and lesser sac. Visceral peritoneum is pain sensitive. Parietal peritoneum is supplied by somatic nerves. Greater and lesser sacs communicate with each other through foramen of Winslow. B is the wrong option. Visceral peritoneum is pain sensitive. Which of the following statements is false about peritoneal dialysis and peritoneal cavity? Peritoneal cavity is used for dialysis because of its large surface area. B. Because of its rich blood supply. C. Because peritoneal cavity is pain insensitive. D. Because of it is rich in lymphatic drainage. C is the wrong option. Thank you for watching this video.
Do not forget to subscribe my channel. Press on the bell icon to remain updated about more video uploads.